this is your Houston chiropractor, Dr. Gregory Johnson. We have Jeremy in here with us, I guess still this morning or afternoon?
Afternoon.
It's afternoon now. Now, Jeremy's had a unique problem that he had that was preventing him from doing his full workouts without severe pain in his left elbow. He had tendonitis back here beyond the olecranon process back here. It's commonly called tennis elbow, but it's tendonitis because we're always gripping things. So we're using our flexor muscles all the time, but we're not doing an equal amount of work on our extensor muscles. So I advised Jeremy to get these little finger bands to do extension exercises. Show him how that flexes that muscle. Yeah. See that you want to work out the extensors, and you started doing this, and you said about 3 days after you started, your elbow pain went away, right?
About 2 or 3 days, yes, sir.
Yep. And you did that. How many sets first couple days?
First couple days, I did 3 sets of 20 to 30 reps.
And was then using you got that on Amazon?
Yeah, so I got on Amazon. It was around $9.
Yeah, and they're called what?
Finger extensors? Finger spreaders, that's all I typed in. And now I use it about once a week, usually with my arm workouts.
And tell them how it's improved your overall lifting
capabilities.
So
not only has it got rid of my elbow pain, but
along with your adjustments, of course.
Along with the adjustments, but it's actually improved the quality of my workouts. I'm able to squeeze the bar and get quality contractions.
And it feels more symmetrical now too, doesn't it?
Yes, sir.
You feel stronger?
Yeah.
Yeah. And you said when you first started using that, you felt like you were getting hypertrophy of these muscles because it was building them up so quickly.
Yes, sir. I've definitely noticed
increased size.
Yes, sir.
Yeah, that is hypertrophy. Mm-hmm. Yeah. So we wanted to share this case with you today because a lot of people have tendonitis in their elbows, which is commonly called tennis elbow. It's inflammation of the tendon. But there's an underlying cause of that, and that's usually subluxation of the actual joint, the olecranon process with the humerus, and then also the flexor muscles are much taunter and stronger than the extensor muscles, so you need to balance that out with doing some finger extension exercises with these little bands, and they start off at 1, you can work all the way up to 5 or 6, right?
Yes, sir.
Yep, get stronger. And you do that about once a week now?
Once a week.
And he comes in on an as-needed basis. We don't schedule him regularly. He just comes in when he feels like he needs to get a tune-up. So we're going to tune him up right now. Okay, let's have you flex your head forward and backwards for me, Jeremy. Thank you for sharing that with everyone, by the way.
You're welcome.
Your head's still just a little forward today. Been sleeping with the big pillow still?
Yes, sir.
Yeah.
A fort built around me.
Oh, okay. Well, that's good. Sleep on your back more? Does it help you sleep on your back more?
Yes, sir. Last night.
Down there. Good. See, so some patients actually do take my advice and sleep on their backs with their legs elevated and they see improvement. It's hard to get used to, so I tell people to build a big fort around them with big pillows at their side, so that when they want to turn over, they run into those pillows, and it makes them wake up and not sleep on their side all night. And Jeremy, he's old pro at this. He relaxes really good, so we get good cavitation for y'all you crack addicts out there. Just like that. I still get happy feet when I do that. Yes, sir. Boy, doesn't get much better than that, my friend. Crack eggs definitely gonna love you.
Oh, felt great.
Yep. I could use one of those about right now. Okay, let's come over here on your tummy. There you go. Legs are even. That's a good start. And they stay even. Did that tighten up any?
Not much. A little bit.
notice I always start down at the pelvis and work my way up. There we go. Yes, sir. Got one more right there. Okay. Perfect. Okay, let's turn you on your back now, please, sir. Okay, slide down this way a little bit. That's good. The reason I adjust the entire body rather than just a specific area on the spine is because that old thing about the ankle bone connected to the knee bone connected to the hip bone is all true. The whole body works in concert with the rest of its biomechanics from the feet all the way up. Okay, let's sit you up and face that way for me. There we go. Now, you always see me adjusting the elbows, but you probably never really paid much attention to how I do it. I'm actually contacting the head of the radius up here, right there, and then also on the back of the olecranon process. Now this is right elbow, this is the good one, but we still get movement there. Adjust his wrist, the carpal bones, and then I pull the finger digits straight out. And this is his old painful elbow. There we go. So you got good movement on that. So I'm adjusting the radial head and the olecranon on that. And also you used ice on it at first too, didn't you?
Yes.
When we first got started? Yep. Okay, let's stand you up over here in front of the mirror. Okay, let's have another look. Oh yeah, that's already better. Look, see you're centered up now. There, you take a look. Right down the middle. Pull
Yes, sir.
these guys up. Come here, back. There. I'm adjusting the atlas with this instrument, which sends a proprioceptive neurological bombardment of information into his cerebellum, helping his body remember how to be in place as opposed to out of place. Stand up good.
Smooth
Feel
as
better
butter.
than when you walked in?
Yes, sir. Smooth as butter.
Good deal. So what would you share about your experience here at Advanced Chiropractic Relief with others? Because you've been to a lot of other doctors for your elbow, right?
Yes, sir.
And you had other procedures done. What did you tell me you had done with Graston?
I had Graston, gua sha, myofascial release done on my arm, and physical therapy, and none of it worked.
Injections?
No injections.
No injections?
No, sir.
You taking medication for it at all?
No.
Never? Good. Good. So you tried the natural means of doing it, but the Graston and the myofascial release didn't cut it.
No, didn't.
So we got your elbow back in place and you started doing the extension exercises.
Yes, sir.
Great.
And overall experience here at Advanced Chiropractic, I've had about 24 visits, and he's changed my life and given me my life back to where I can go back to school and work more, and I don't have to go and lay down every 20 minutes, so that's nice.
Yeah, that is good. So it's nice to live your life at its fullest, isn't it?
Yes, sir.
Well, thank you for sharing your story with everyone.
Thank you.
This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas, where we practice hardcore chiropractic every day. We'll see y'all soon.